Symptoms to watch out for. Many Filipinos feel tired, nervous, or have neck pain. Often we think this is just because of work or stress, but what if there's a deeper reason? This is hyperthyroidism. Hyperthyroidism is a condition where your thyroid gland is too active. The thyroid gland is a small, butterfly-shaped organ in your neck. It makes thyroid hormones that are important for your body's metabolism. When there are too many of these hormones, it's like an engine running without brakes. All processes in your body speed up, from your heartbeat to how you digest food. How do you know if what you're feeling isn't just simple tiredness? Let's look at the signs. Someone with hyperthyroidism often sweats a lot and can't stand the heat. Even when it's cold, they feel hot. Their heart also beats fast, which is called palpitations, even when they're resting. You'll feel like your heart is racing. Besides this, many of them have shaky hands, which makes it hard to write or hold a cup. These symptoms should not be ignored because they are signs of a problem with your thyroid. Changes in mood and energy are also major symptoms. You might feel very anxious, irritable, or have trouble sleeping at night. Because your metabolism is fast, you also lose weight quickly even if you eat a lot. Many people are happy about sudden weight loss, but if it's unintentional and comes with other symptoms, you should be concerned. Women may also experience changes in their menstrual cycle. Sometimes, swelling in the neck, called goiter, is also seen, which is a clear sign of a thyroid problem. Let's not mistake hyperthyroidism for a simple stiff neck from using a computer. A stiff neck is muscle pain due to bad posture. Hyperthyroidism, on the other hand, is a hormonal imbalance that has a wide effect on the whole body. Neck swelling from goiter is different from neck pain. Goiter is in front of the neck and can get bigger. Symptoms like changes in weight, mood, and heart rate are not experienced with an ordinary stiff neck. So if you have a combination of these symptoms, it's important to see a doctor for a proper checkup. There are many possible reasons why the thyroid gland becomes overactive. The most common cause is Graves' disease. This is an autoimmune disorder where our own immune system attacks the thyroid, causing it to make too many hormones. Another reason is having thyroid nodules or lumps in the thyroid. Some lumps are called hot nodules that release their own thyroid hormone. Thyroiditis is the inflammation of the thyroid gland, which can cause a temporary leak of hormones into the blood. Too much iodine intake from food or medicine can also trigger hyperthyroidism. Here are 10 possible diseases or conditions that cause hyperthyroidism. First, Graves' disease, the most common. Second, toxic multinodular goiter, where many lumps release hormones. Third, toxic adenoma, only one lump is overactive. Fourth, thyroiditis or inflammation of the thyroid. Fifth, pituitary gland tumor, a rare cause where the gland in the brain tells the thyroid to be overactive. Sixth, taking too much thyroid hormone medication. Seventh, iodine-induced hyperthyroidism. Eighth, trophoblastic tumor, a rare tumor related to pregnancy. Ninth, struma ovarii, a rare ovarian tumor with thyroid tissue. And 10th, thyroid cancer, although rare, can also be a cause. Besides these diseases, there are also risk factors that increase the chance of getting it. Being female is one of the main risk factors. It happens more often in women. Family history or genetics is also a big factor. If you have a relative with a thyroid problem, your risk is higher. Age, especially if over 60, also increases the risk. Having other autoimmune diseases like type 1 diabetes or rheumatoid arthritis is also a sign. Smoking is not only bad for the lungs, it also worsens Graves' disease, especially its effect on the eyes. Here are 10 risk factors or reasons why you might get hyperthyroidism. First, being female. Second, having a family history of thyroid disease. Third, a personal history of other autoimmune diseases. Fourth, age 60 or older. Fifth, recent pregnancy. Sixth, smoking. Seventh, severe emotional or physical stress. Eighth, trauma or injury to the thyroid. Ninth, too much iodine intake from supplements or food. And 10th, using certain medications like amiodarone for the heart. Knowing these risks can help us be more watchful of our health. A common question is whether long-term laptop or computer use causes hyperthyroidism. The direct answer is no. There is no scientific evidence linking radiation from laptops or the posture of using them to the development of hyperthyroidism. This disease is hormonal and often autoimmune. However, laptop use can have an indirect effect. Work that requires long hours in front of a computer is often a source of intense stress. And stress is a known trigger or aggravator of autoimmune conditions, such as Graves' disease. Stress releases a hormone called cortisol. High levels of cortisol over a long period can disrupt the immune system. If you already have a predisposition to hyperthyroidism, intense stress from work, family, or personal problems can trigger the onset of the disease. It's like pushing something that's about to fall. So even if the laptop itself isn't the culprit, the lifestyle associated with it, stress, lack of sleep, and neglecting oneself, can contribute to the worsening of your condition. That's why stress management is important. Another big concern is whether hyperthyroidism can lead to thyroid cancer. In most cases, hyperthyroidism, especially Graves' disease, is not cancerous. It is a benign or non-life-threatening condition. However, there is a small connection. Thyroid nodules or lumps that cause hyperthyroidism need to be checked. Although most of these lumps are benign, a small percentage, less than 5%, can be cancerous. So if you feel a lump in your neck, it needs to be checked by a doctor using ultrasound and, if necessary, a biopsy. When is surgery or thyroidectomy needed? Surgery, or the removal of the thyroid gland, is one of the treatment options. The doctor will recommend it if your goiter is large and you have difficulty swallowing or breathing. If you have toxic nodules that don't respond to medication, surgery is also the solution. If thyroid cancer is suspected based on the biopsy, it needs to be removed. And for patients who don't want to take medication for life or can't undergo radioactive iodine therapy, surgery is a permanent solution. The decision will always be discussed by the doctor and the patient. Untreated hyperthyroidism is very dangerous and can be life-threatening. When your metabolism is always fast, it's like running your body too fast without rest. This puts extreme stress on the heart. One of the most dangerous complications is atrial fibrillation, an irregular heartbeat that can cause blood clots, stroke, and heart failure. Your bones can also weaken and become brittle, called osteoporosis, because thyroid hormone speeds up bone mass loss. The most severe emergency is called thyroid storm or thyrotoxic crisis. This is a sudden and severe worsening of symptoms. The patient will have a very high fever, extremely fast heart rate, dizziness, vomiting, and confusion. This is a life-threatening condition that requires immediate medical attention in the hospital. If not treated quickly, it can be fatal for the patient. That's why it's very important not to ignore the symptoms. Early consultation with a doctor and following treatment are key to avoiding such serious complications. How can we prevent or treat this? The first step is a correct diagnosis from an endocrinologist. This is done through a blood test to measure your thyroid hormone levels. There are 3 main ways of treatment. The first is taking anti-thyroid medications, which prevent your thyroid from making too many hormones. The second is radioactive iodine therapy, where you take a pill that will destroy the overactive thyroid cells. The third is surgery or thyroidectomy, which will permanently remove the gland. The right treatment depends on your age, the cause of hyperthyroidism, and its severity. Finally, I want to leave a message of hope. Hyperthyroidism, even with its frightening symptoms and complications, is a condition that can be treated and controlled. There is hope for recovery. All that's needed is early intervention, discipline in taking medication, and regular checkups with your doctor. Let's also live a healthy lifestyle. Eat right, exercise, and find ways to reduce stress. Please don't be afraid to consult. Knowledge and proper action are your strongest weapons against this disease. Let's take care of our health. God bless us all.